Flat feet are simply as they sound. They are feet that have lost the longitudinal arch. They often are called pes planus or pronated feet. There are two types of flat feet. One is a congenital flat feet, where simply you're born where the arch is not what we consider a normal arch, and the other is an acquired flat foot, which often occurs in women over the age of 50, predominantly over the age of 60, due to a degenerative tear of what is known as the posterior tibial tendon. Congenital flat feet aren't necessarily a disease, so if you have a flat foot but you have no symptoms, we don't need to treat you at all. If your symptoms are relatively mild, then a good arch support can be put in your shoe and you can do well. One has to remember, though, that the foot, the arch support, and the shoe must function as one unit, and so you just can't get an arch support and put it in any shoe, and that's where we use the expertise of our pedorthist to make sure that those things function as one unit. In very significant cases of pain or deformity, surgical treatment is an option in congenital flat feet, and we do that occasionally in teenagers or young adults in order to help with their symptoms. Acquired flat feet are much different, though. Acquired flat feet are a disease, and they need treatment right from the beginning of diagnosis. So that early on, we can try non-surgical treatment, which might include an orthotic or usually a brace. Patients have to remember, though, that that's not a cure for their problem. It's simply helping with their symptoms. And if that works, it's great. But if it doesn't, then we often rely on surgery to get them some more relief. One of the problems that we run into is that because acquired flat feet are a disease and they're progressive, the surgical treatment that one would get early is much different than the surgical treatment one would get late. And so if we can catch this at an early stage, we can often do things that bring the foot close to being normal, whereas if we do the surgery later, in cases of severe deformity or where the foot's become arthritic, we often have to do a surgery that gives patients good pain relief and function, but it results in stiffness of the foot. Diagnosing and treating flat feet is complicated. Each person has a deformity that's unique to them. And so at orthopedic specialists, we provide a multidisciplinary approach that provides non-surgical and surgical treatment to each patient in the hopes we can get an optimal result.